We do have treatments approved now for progressive forms of MS, although they tend to limit progression in a fairly modest fashion. So there absolutely remains an unmet need in terms of therapies that can more effectively limit and ideally stop progression. One approach, of course, is to treat early with high-efficacy therapies, and we think that that does likely change the longer-term trajectories of progressive disease. We also think that the progressive disease biology almost certainly exists under the surface much earlier than it manifests clinically. And so for a large range of the age span of someone living with MS, there may be both the relapsing inflammatory biology as well as the non-relapsing progressive biology. Other pathways to try to consider would involve targeting central nervous system compartmentalized mechanisms of progression. These include inflammation that is not the same as the inflammation that's based on waves of immune cells infiltrating from the outside in. We think of those as the biological substrate of relapses. But here we're talking about CNS compartmentalized inflammation, the potential for immune cells around lesions, but also in the meninges of patients that may be influencing the underlying tissue. And then there are other mechanisms that are degenerative that almost certainly play a part as well. And there we recognize that there may be certain toxic substances released, there may be mitochondrial energy supply that is being outstripped by the demand. There's uncoupling of support from one cell to another when one cell is injured, and if other cells depend on it, that second cell may indirectly be injured over time. And so understanding these additional mechanisms better and being able to target these processes within the central nervous system represent some of the major challenges that we still have to meet this unmet need. I think there's been progress made in recent years in terms of some of these CNS compartmentalized pathways involving both degeneration, injury, and repair, although for the most part these are still in early phase trials or even in preclinical models. There are efforts to support regeneration in addition to preventing injury, and of course very important ones as well, whether remyelination or neurite extension. Those would be amongst the most exciting approaches, but relatively early days.